What's going on, everybody? Toby coming at you. This is Sunday, the 16th of August and October. I almost combined the both of them. Today is Sunday, the 16th of November. So today marks 41 weeks since my surgery. I'm going to give you some updates about me, some advice from my experience here, and then we're going to go into some hacks or tips for you to think about that might help you, that have helped me and might help you during your recovery and rehabilitation. Okay. So stick around to the end to catch all this stuff. So first of all, I had my annual primary care doctor, annual physical or annual follow-up or annual appointment last Friday on the 14th, and had labs the week before that. He said all my labs look good. And a key takeaway on this also is my testosterone was good within normal levels. Why is that important? Because prior to having open heart surgery for about, I guess it was maybe 6 months to a year, maybe a little longer, I was actually getting injections of testosterone, prescribed injections at my civilian primary care provider to help with as a supplement to testosterone, because I was way below the required levels for my body, my biology, and all that stuff, right? My body type, whatever. After my open heart surgery, and I had my follow-up with for those that don't know, I'm a veteran, so I have a VA, Veteran Affairs doctor, and I also have a civilian doctor. I think I've covered this before. But either way, so I see both of them. I see two different doctors, and the labs through both of them said that my testosterone now is at a normal level. And the civilian doctor suggested that, here's the news flash, why this was important, suggested that the conditions with what was angina, what was problems with my heart that required the open heart surgery, may have been a direct factor as to why my testosterone, my body was not producing the required levels of testosterone I needed. So that is a good thing, another positive byproduct or side effect, or whatever you want to call that, of the open heart surgery. Unfortunately, I guess that's, when your heart's not pumping at the levels or the performance or the optimization it's supposed to, other factors in your body and your biology suffer. So the next piece is on another piece, and this is more of a hack for anybody, just so you know, after you have had open heart surgery, okay? If you have to go to any other appointments after having open heart surgery, and I'm saying any other appointments that are not related to open heart surgery, and I'm speaking specifically from my perspective, my foxhole, but the appointments outside and not related to open heart surgery might be something different for you. For me, in this specific example, the appointment was a dental appointment. Okay, I had a dental appointment in May, I think it was April-May timeframe, and then I had another one about a week and a half ago. Okay, and I just remembered I wanted to make sure I wrote that down for notes. Because I'm on blood thinners, and during a dental procedure, they poke and prod. You all know that they poke and prod around your gums and around your teeth to make sure, check gum sensitivity, and they check for gingivitis. They check for all this stuff, right? Receding or recession in the gum line on the tooth, all that kind of stuff, right? Or even if you're told that you have to get a cap or an extraction or whatever you got to do, right? If it turns out, and this is after your open heart surgery, you need to make sure well before the surgery or well before the appointment, make sure you get notification or clearance from your cardiologist sent to that doctor, the dentist, the whomever, for clearance, saying that you are cleared to have that kind of surgery or that kind of procedure. It could be something as simple as, hey, you split, maybe something happened to you. You cut open your arm and you need stitches. This is an emergent type of situation. That might be an extreme example. But anyway, the point is any kind of scheduled thing that's outside of outside of your follow-ups or whatever for open heart surgery, I would say dentist, and that's just the biggest one that comes to mind, but dentist and, whatever, something where they might have to, I'll just be quiet and leave that to you. You might have your own situations that you have another appointment for. Doesn't mean you got to call on every single thing, maybe. I don't know, but definitely like dentist, make sure that you call contact your cardiologist and have them provide you with whether it's a digital, through the messaging system you have or an email or whatever that you can relay to your dentist or have them contact them directly. Whichever the case might be, you need to make sure you get clearance from your cardiologist, not your primary care manager. My dentist wanted a note or wanted something from the cardiologist indicating that I was cleared for a dental follow-up procedure, whatever, poking, prodding, anything. So I just figured that, would be a good tip y'all want to know, because I didn't think about that when I had my first dental appointment. So far, like I said, I'm doing better. All my labs and everything said good. The doctor said my kidneys were good. The testosterone's good. My A1C, he said, was right at about, I think he said 6.1, which is right at that lower threshold for pre-diabetes, diabetes. He said, but your weight is looking better. Just stay with the prescription that I'm taking, which is I take a dose of 2 metformin tablets per day, which is down because for a while I was taking 4. He said, stay with it, keep working on your weight and everything else, weight and exercise, weight and activity, right? We've talked about this before, and I'm doing good. So that's really about all for my open heart surgery, rehab, and recovery for me. Walking has been kind of a challenge, not doing it, but just the sticking to the schedule. And I'll cover that in another minute. Okay. So you'll hear that in a minute, but, yeah. So, let's get on with these, my tips and hacks. Okay. So one hack I'll tell you is this, y'all. And I was just talking about this for myself, right? Lately, probably the last week or two, right? It can be difficult to stick with the walking thing. And I said this in past videos back when I was doing it zealously every single day. I even did videos of me walking, or started videos with me walking and saying, I got to do this every day. I have no choice. I've got to, right? My life, my family, my livelihood depends upon it. Well, that is true. But we all know life happens, right? Things come up, things get in your way. Depression, not necessarily me, but depression, anxiety, just life stuff in general can affect your moods, affect your energy. I'm not making excuses. I'm just saying my point is, don't beat yourself up about it, but try to stick to a walking or exercise or just activity level routine. Try to keep it going, guys, at least once, twice, 3 times a week, maybe. Weather dependent, of course, if your situations allow, but don't. The biggest takeaway from this is stick to it, but don't beat yourself up. I beat myself up about it. Don't beat yourself up. Don't chastise yourself. Just remember each day is a fresh new day. Today is a gorgeous one. It's about 58 degrees outside is the high today. I'm going to try and get out and do a walk in some. Take each day fresh. Start fresh. When you wake up in the morning, that's a whole new day for you to get into a walk, get into a run, get into whatever it is that will keep you active for an hour and a half or so, 90 minutes or so. Okay. So that's one hack. More of an encouragement than a hack, I would say, right? So one thing I would strongly recommend you do, I recommend daily, but at a minimum, do it weekly, is to take pictures of your scars and your graft scars and your chest scar, okay? Because this way it helps you monitor it and it helps you see the progress weeks, months down the road later on. So this is how I do mine. I mean, it's pretty simple, guys. I just open the camera app, but I turn it facing the actual, not the selfie camera, but the actual real camera uh, facing me, and I line it up with my incision, the 3 holes from where the tubes and wires were, and then here with the scar, and I just take the picture. So that's the first picture. Second picture is of my graft site right here. I have one on each leg, inner thigh, as I've been telling y'all about. Some of y'all might have more than one graft site scar. So what I use is an app called Timestamp, and it puts the date and time on the picture when I take the picture. And that's all I do is just make sure you get good lighting on the scar, and I take the picture. And then I turn it around and I repeat the process. Again, you want to make sure you bend your leg back as far as you can, as far as you're comfortable with, to get good light. Now, one thing I didn't mention on the other leg was I do it on both, is I put my fingers right here above the scars so that I have a gauge, sizing and healing and recovery gauge of the scar as it progresses. And that's the picture I've taken. I've shown you all these pictures before. And you all seen these pictures before with my fingers right above my graft sites. And I've showed you the chest scar. So again, I do that every single day as a part of my hygiene process. So I can, like I said, track healing and track the scar shrinking, reducing, whatever you want to call, whatever label you want to put on it. So that is, in my opinion, one of the best hacks you can do for encouragement for yourself. Another tip for you to take is if you don't already have these or have one of these, I strongly recommend a pill caddy. Okay, a pill container, something that they come in all sorts of different shapes and sizes, but this one in particular covers a weekly time frame for me. So if you're going through or going to be going through or already have gone through open heart surgery or a valve replacement or anything like that, if you're not already on a bunch of medications, you probably will be for at least an extended period of time, first year after the surgery. So I would strongly recommend these things. Huge, huge asset. All right. So as you saw earlier, I was telling you about the graft sites, right? Taking the pictures. One other piece I would also tell you about, as far as your scar sites, right? The scar for your open heart, on your sternal scar, and your grafting sites, everybody's going to be different. I don't know for you. I don't know for where the grafting sites were. I'm cautiously assuming that oftentimes grafting sites are from the inner thighs, like mine were. But my understanding is they can, from what I was seeing and from when they were doing the ultrasounds on my body, looking for the right graft sites, they were ultrasounds and checking my neck. They were checking my ankles. They were checking the bottoms of my feet. They were kind of checking all over. So the point is, wherever they took or they did the scars for grafting arteries from you on your body, the point is, when those scars, when those scabs have fallen off and are gone to where you just have the scar itself, I'm going to suggest to you to continue or to do this. This is something that what I do is I feel my scars like every day. And I don't mean like all fetish and freaky style. I'm talking like I will lay in bed at night or in the mornings or whenever I'll just sit here and I'll go like this, right? Up and down around my scars, right? I just kind of go around them every so often. And I do this around the edges and stuff. And that kind of helps. Hopefully, my thought is kind of like the rice thing we talked about in a previous video, doing this on my legs. I kind of feel like this. I'll rub along the scar, around it, testing it to try to both feel it out, see if I'm having any feeling change or return or sensation. But I'm also just kind of trying to stir or stoke maybe the nerve endings and stuff, and trying to wake them up, so to speak. It's like I said, the same concept as that rice thing, right? Is that you drop, as I told you about a buddy of mine who had his hand injured, and one of the things they were doing was dumping rice repeatedly on top of his hand to stimulate, that's the word I was looking for, stimulate nerve endings to help get feeling to return to the all of the areas of the skin as best as possible. So whether it's on your both your grafting sites where they grafted and they harvested our arterial veins from, our arteries from, or here at your chest, I would recommend doing it in both areas, as many areas as you have. I've got 2 where they harvested arteries from one side, not the other, but they still went into both. You might have 2, you might have 3, you might only have 1, I don't know. But I would strongly recommend just doing it. It's not like, I'm not saying go out when you're at a party or public gathering, do this and, get people looking at you. We don't care about perceptions, but that's not exactly a regular, normal activity I would do in a public event, right? So, but aside from that, I don't have anything else to share with you all for this week, for me, or for hacks and tips. I will say, please, again, keep Riley in your prayers. Yeah, this girl turns 16 next month, December next month. And she has gone through so much as a 15-year-old, as a 14-year-old. It blows my mind, her and her family's resiliency and their strength and their perseverance. Like I said, the link for the GoFundMe is going to be up here, and it will also be in the description below. Please keep them in your thoughts and prayers. As I've said, donate if you can. If you cannot, please share. Again, share, because prayers, best wishes, and everything really help encourage the family, knowing their situation is out there for people to pray for. I will say that I believe a praise report on her behalf is definitely welcome, because her G-tube surgery was a complete success. And that was a couple days ago. I think it was either yesterday or day before. It was this past week. I know that. And from what I saw, it was a complete success. So praise God, praise report for that. And now we're just hoping for the rest of the stuff to come up so that she can get that kidney transplant quickly and happen very soon, and hopefully start getting into some semblance of a normal 15-year-old, 16-year-old's life, So again, Riley, we're praying for you. Know that you are in our prayers. You're in our thoughts. We love you. Thank you all very much for watching and for sharing Riley's story. Thank you for following and commenting. Please, as I've said before, and I say it all the time, and I'm going to continue to say it, share your experiences about open heart surgery, valve replacement, whatever the case might be. Share in the comments. Put your experiences down there, good, bad, whatever, because somebody else out there may have experienced something like this, and you are encouraging them for no other reason, y'all. It's letting people know that they're not alone in what they're experiencing and what they're feeling, the depression, the emotional roller coasters, the feelings of helplessness, feelings of, I don't want to be a burden on other people. This stuff is real, and you need to know that you were not any of these things. Get out of keep positive attitude going, keep the positive vibes going, keep your prayers going, keep your activity going. Sitting and festering and thinking nothing about how the surgery was, how it was, and when are you going to get out of it? When can I get back to normal life? When can I stop being a burden on people? That stuff needs to go in the trash can, okay? But you sharing your experiences helps other people, even if they're negative ones. It helps people know I'm not the only one out there dealing with and experiencing this stuff, okay? So again, thank you so much. Until the next video, y'all stay safe. God bless you. Have a wonderful week. Have a wonderful day.